variously sized particles. So even the LDLs, you can have big LDLs, intermediate size LDLs, and small LDLs. They're all LDLs because they have the buoyancy where they would go in the LDL range in a centrifuge. But the bigger LDLs float a little higher than the smaller, denser LDL particles. But they're all LDL particles. They all have one ApoB. An LDL-ApoB or an LDL particle count is the sum of big LDLs, intermediate LDLs, and small LDLs. What really matters with LDLs is total LDL particle count or ApoB. But there's a lot of talk out there. Oh, the big LDLs are not so dangerous and the small LDLs are worse. That needs some maybe, maybe not. I laugh for people who say that. One of the more lethal lipid disorders that we have is familial hypercholesterolemia. They have incredibly high LDL cholesterols, defined as typically in an adult above 190 milligrams per deciliter. So they all have big, fluffy, buffy, buoyant LDL particles, and they sure get a lot of atherosclerosis. So that shoots down the theory that big LDLs are not atherogenic. Now, the small LDLs are an LDL particle. And the problem is in people who develop small LDLs, and that's virtually everybody who has elevated triglycerides, that's where this type of LDL is seen with prominence. And that's because when trigs go up, trigs go in the LDL, and lipases dissolve the triglycerides, which shrinks the LDL particle. So it's triglycerides that make the LDL particle small. Now, here's the problem. A few minutes ago, I alluded to something called hepatic clearance of LDL particles. The liver expresses a receptor called an LDL receptor, which is specifically engineered to bind to and recognize the ApoB on an LDL particle. So the LDL receptor grabs the particle and pulls it into the liver where it's catabolized, and it obviously cannot hurt you in the liver, causing atherosclerosis. The problem is the LDL receptor only recognizes ApoB when it's on an intermediate particle and it has a certain conformation that aligns to the electrical charges on the LDL receptor. So if you have a small LDL, the ApoB assumes a different shape. And the LDL receptor doesn't recognize it as readily as it would. So small LDLs have decreased clearance from plasma. And that's why most people with small LDLs have increased LDL particle counts, because the small LDLs cannot be cleared. And remember, what drives atherosclerosis is LDL particle number, not the size of the particle. But au contraire, just the opposite. If you have a really big LDL, such as an FH, the ApoB also assumes an abnormal conformation, and the LDL receptor doesn't recognize that LDL as readily either. And that's part of the contribution to the high ApoB in people with familial hypercholesterolemia. So people should not dwell on small or big particles. What we should dwell on is total LDL particle count, which is guesstimated by LDL cholesterol, much better by non-HDL cholesterol, or measure ApoB. If you take the people which, for some reason you've measured that, oh, they have small LDLs, the next thing you should do is a total LDL particle counter in ApoB, or look more closely at non-HDL cholesterol, and you would see, my God, no wonder the small LDLs are so dangerous. They're driving particle number through the roof. So that's the where this small and big comes in. I think all the studies have shown if you have too many big LDLs, you're at risk for atherosclerosis. If you have too many small LDLs, you're at risk for atherosclerosis. But I will say this, the small LDLs, as I indicated, are caused by triglycerides. In other words, they occur in insulin-resistant people where there's a lot of metabolic abnormalities going around. So people with small LDLs not only have too many LDL particle counts, they have inflammation, they have glucose abnormalities. So they have multiple things which put them at even higher risk for atherogenesis. So it's not all the small LDL, it's who else does the small LDL hang around with in your plasma? And it's a lot of bad actors there.